As it has been mentioned, NACADA commissioned a survey to document the knowledge, attitude, perception, and practices on drugs and substance abuse within our primary schools. Drugs and substance abuse continues to be a worldwide problem and affect many children and adolescents. Early initiation to substance use increases the risk of future substance use disorders and other negative outcomes, as the report has been indicated. The findings of this study indicate that 20.2% of primary school pupils have ever used at least one drug or substance of abuse in their lifetime. It is worth noting that prescription drugs are becoming popular among the young people, with 10.4% of pupils have never used them in their lifetime. It is shocking to note that the average lowest age of onset drugs and substance abuse is 4 years, and the median age of initiation is 11 years. This trend is a great concern, and it is detrimental to the future of our nation. According to the report, 29% of the people get drugs from shops or kiosks near their schools, 26% from bars near schools, and 14% from school workers. The report also cites that people who accompany their parents to premises where alcohol or drug is served were most likely to use drugs or substance of abuse. The entertainment world continues to glorify alcohol and drug abuse, contributing to curiosity among our children, which leads to experimentation. In the light of this, parents need to be aware of what their children are watching and listening to. In addition, my ministry commits to the finalization of gazettement of the alcoholic drink control guidelines to regulate advertisement and promotion of alcohol drinks in Kenya. Ladies and gentlemen, it is worth noting that several policy measures have been put in place by various government ministries and agencies to curtail drug and substance abuse in schools. One key area is integration of drug education components in the school curriculum by the Kenya Institute of Curriculum Development, KICD. Subjects such as social studies, religious education, extracurricular activities such as drama and music have incorporated items on drugs and substance abuse in their syllabus. Towards the realization of universal health care coverage for all, the Ministry of Education and the National Health Insurance Fund have set up the Education Afia program. The program offers a unique, comprehensive medical insurance cover for public secondary students that caters for specialized services such as drugs and substance abuse rehabilitation services. I urge my colleagues at the Ministry of Education to direct all their students suffering from alcohol and drug addiction-related disorders to seek treatment from our hospitals and NHIF-accredited rehabilitation centers under the Education Afia program. In addition, school hands to be vigilant not to engage those purporting to be expert in the campaign against alcohol and drug abuse. I urge school heads to always partner with NACADA to undertake well-structured and evidence-based programs within our learning institutions. Ladies and gentlemen, the launch of this report couldn't have come at a better time. I am informed that NACADA is in the process of finalizing their 2019-2022 strategic plan that has incorporated programs based on the recommendation in this report. In the support of NACADA's work, through my ministry, we shall reach out to the Ministry of Education to support the foreign school-based program. 1, facilitating the implementation of evidence-based school programs on drugs and substance abuse. 2, development and implementation of drugs and substance abuse policies in all institutions of learning. 3, capacity building of guidance and counseling teachers on drugs and substance abuse prevention and management. 4, review of the teachers' training curriculum to incorporate drugs and substance abuse prevention and management. And finally, development and implementation of life skills programs in schools. My ministry fully appreciates the effort by the Ministry of Education to curb drugs and substance abuse in our learning institutions, and to look forward to partnering with the ministry to conduct a national survey to establish the prevalence of drugs and substance abuse in our institution of higher learning. Ladies and gentlemen, I wish to state that the government is committed to the implementation of the recommendations of the findings aimed at creating a positive school culture for our children to excel and feel supported. It is on this note that I direct the regional commissioners to ensure the following. 1, that there should be no bars or alcoholic drink selling outlets within 300 meters from schools as per the provision of the law. Number 2, any alcoholic drink selling outlet that allows a minor should be dealt with as per the provision of the law. Number 3, there should not be any liquor selling outlet within residential areas as per the provision of the law. And finally, we partner with representatives from the Ministry of Education to ensure that there are no kiosks or even structures around school fences. Ladies and gentlemen, allow me to appreciate the Ministry of Health for setting up the youth-friendly treatment and rehabilitation outpatient centers at Kenyatta National Hospital to cater for the growing needs of our youth suffering from substance use disorders. I urge my colleagues at the Ministry of Health and county government to set up more of such centers across the country to increase access across the country. In addition to this, to amend the Tobacco Control Act 2007 to enhance penalties of the offense of selling cigarettes to minors and selling cigarettes in single sticks. Ladies and gentlemen, as I conclude, allow me to talk to my fellow parents. As parents, we have a key role in shaping our children's behavior. Findings of this survey have revealed that our children are influenced by us. The bottom line is that we need to be positive role models to our children. I therefore call upon teachers and parents to create time and talk about alcohol and drug abuse with children, as well as reinforce the norm for alcohol and drug-free environment in our homes and schools. Finally, I wish to reiterate the need for collaboration among stakeholders, especially government agencies in the education sector, in tackling drug and substance abuse in our learning institutions. With these remarks, I now wish to preside over the launch of the report on the status of drugs and substance abuse among